As a youngster, I wanted to paint like Monet or the big boys, and I couldn't compare to that. So I didn't have the confidence until I retired, and then I didn't care what anybody thought. I just liked doing it. My name is Gadine Acton, and we're in Prairie Village, Kansas. I've been independent a long time, and I'm used to planning and solving problems, but this was something beyond me. I was housebound, and I'm a practical person. I thought this was it. This is the way I'm going to live. Just do the best you can. But then CenterWell Home Health came, and they didn't see it that way. They looked at me, they listened to me, and then I get a little weepy thinking about it. They solve problems.
Miss Gadine was just a light and a joyful presence to meet. The first time I met her, she was sitting in her wheelchair waiting for me to come. It was a big change for her to go from being completely independent to having to rely on assistive devices like wheelchairs and walkers. And I said, Miss Gadine, we are going to get you feeling better.
In the hospital and rehab, they don't have the time for the education, but Becky did. And besides that, they had a better understanding of my environment, how they could help me live where I live. I really felt like I was in good hands.
Because of CenterWell Home Health and our Keeping Hearts at Home program, I was able to do some very detailed investigating with her. We noticed that she had symptoms going on as a result of her cardio function. We were able to go back and forth with the cardiologist and change some medications around that made her more comfortable and really made her safer at home. We learned about how to control pain and swelling with diet and exercise, and relatively quickly, she started getting that sparkle back in her eye.
I really felt like I was a part of the team too. I liked that feeling.
Through working with her, we were able to take this massive swelling and pain in her legs and improve that so much that she went from being in a wheelchair to having pain-free mobility again.
I give them a lot of credit for giving me my independence, for getting me back on my feet. I couldn't have done that by myself.
Knowing that not only are we relieving someone's pain, but we're boosting their confidence and bringing back some happiness into their day-to-day activities is a big goal of mine as a nurse.
In a way, it feels like I won. And so now, even though it's not efficient, I usually drive somewhere every day because I can, and I want to.